2, 1.
Hello everyone! Luzon, Visayas at Mindanao. I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine physician, and you are watching DANGPANAN, a Doc Shi TV live health talk series. If this is your first time watching, we do this training regularly and simultaneously in Facebook and in YouTube, Doc Shi TV. So if you're watching from YouTube, please click that subscribe button and turn on that notification bell for you to be notified on future videos. If you're watching from Facebook, click that follow button and share away. The goal of this program is to get in touch with you, modern Filipinas, to various social media platforms to empower you to take charge of your health through correct and science-based information. DANGPANAN, a Bisaya term for shelter, is chosen to be the name of this program because I want to share this shelter of comfort and good education to you, my dear viewers, through a platform that is accessible to all. Welcome to another educational health talk. And what's more, you do not just learn. Lucky viewers will also get a chance to win a free online consultation coupon. So, stay tuned till the end because you might be today's lucky winner. So invite your friends by typing their names in the chat box and click that share button. Don't forget, ako ang inyong DANGPANAN, hashtag DANGPANAN, DocShi TV, or hashtag DDS TV.
DANGPANAN, kabahin sa panglawas o relasyon. Doc Shi Armero.
Hello. Good evening, good morning, good afternoon to all our lovies watching DANGPANAN. It's 8 p.m. here in the Philippines. Alas 8 po ng gabi ngayon and it's Father's Day dito. Happy Father's Day to all our dads watching with us. And if you are watching again from wherever you are, can you type in your name so I can say hi and good evening to you all if you're watching here from the Philippines. If not, sige, sabihan nyo ako nasan kayo nanonood para ma-shout out ko na din po kung nasaan kayo. Again, happy Father's Day to all our fathers watching with us. But before we proceed, we have been celebrating this whole June. Sabi nga, it's Pride Month. So let's make DANGPANAN attuned with whatever we are celebrating this month. Liban lang sa Father's Day today, and it's our wedding anniversary tomorrow. Sa happy wedding anniversary to Jay, my husband. Advance, kaya napauwi ng maaga. I just would like to say hi to all of my new friends. We went for a bridal shower in El Nido. Hi, Dan. Advance congratulations and to all her friends who invited me with them. It was such a wonderful time. And ayan na. Thank you. Hi, Ate Myra Ann, watching from Butuan City. Thank you very much for being with us tonight. I know it's a Sunday night, it's a family night, but kasi our guest is hindi pa po from Philippines. So it's an honor to have him. But before I introduce him, I would just like to once again invite everyone sa ating Walk With Me. What is Walk With Me? It's our move to move. It's just walking together. So mag-a-update ako kung saan na ang next walk natin kasi sa Abiliana ngayon or sa sa oval, bawal pong pumasok muna doon. So we will be changing and then we will be updating for the location of Walk With Me. So I'll just show the video that my daughter has prepared for us. So just to give you an idea what Walk With Me is. So this is it, and then type again. I'll read all your greetings later. Ayan. So, ganun lang. It's just walking with me, literally. We just walk. And then for those who would like to also discuss some matters, yung nakita niyong post na nanganak siya bago lang, she joined us in Walk With Me before she got pregnant. And thankfully naman, praise God, I just would like to say hi to Ellen. Hi, Ellen. How's motherhood so far? Happy Father's Day to your husband. Thank you for sharing your journey with me, with us, in the page especially. You have been an inspiration to a lot. So, ayan. So, we are down to the episode tonight. Hello, Sal. Thank you for being with us. Good evening. Okay. Ayan. Hi, hi, Ate Myra May Beadle. From wherever you are, nasabi niya, secret watching. So, thank you for being with us. Okay. I really took time to invite our guest because hindi naman kasi masyadong pinag-uusapan dito sa Pilipinas yung topic natin tonight. So nag-invite ako ng imported dito. So I hope we will maximize our episode tonight because it's really not only interesting, it is educational for all. Because again, we want to be inclusive. I want my patients, especially you, hindi ko man kayo makita face-to-face sa clinic. I know you have been watching, so thank you for being with DANGPANAN all these years na tayo. Nag 1 year plus na tayo. So all these years, thank you for being with us. I hope you will learn tonight. Hi, Mar. Thank you. Ay, hello, naka-watch ka. Yes, bagong haircut kasi may ikakasal sa weekend. So nag-ayos ako. Okay, ayan. So again, thank you for being with us. So it's just that I wanted this to be not only interesting. I want everyone to be aware na these things are happening around us and there is no point na hindi na pag-usapan because we are awkward. We have to be open. Ako personally, you know naman na I'm very open with my stand, with my faith, with even abortion. Ang daming nagte-text sa akin, nagme-message about abortion, and you know my stand. But why did I put a safe zone by June 1 sa page? Because nga, with my research, sa nalaman ko, with how I was able to learn, there is so much that I have to learn about the LGBTQI community and I'm still learning. Kaya I am not the best person to talk about this. Kaya naghanap ako ng guest. And you know what? He is here with us tonight. It's 4 a.m. sa Phoenix, Arizona, United States of America. But he is here with us. Let us welcome Dr. Josh Jalad. Thank you very much, Dr. Josh, for being with us tonight.
Thank you for having me. It's a pleasure to be here.
Ayan. Okay, kasin ko si Dr. Josh. So, ngayon formal muna kami because we are gonna talk about a very important topic na I hope ma-learn ng maraming viewers. Okay. So, Dr. Josh is an internist in Banner and nung pumunta ako, you saw my pictures, he was the one who toured me around Phoenix. And Sedona. Sa Sedona, it was a very wonderful place. Thank you very much. Ayan. So, Dr. Josh, let's start na. How are you? How are you muna? How are you so
I'm
far?
doing
Happy
well.
Father's Day.
Thank you. Thank you. I know. It's 5 a.m., 5:16 a.m. over here, so it's not too early.
Early because you're used to sleeping late, waking up early, but I know this could have been your rest day and I'm just thankful that you are with us. So, let's go. Una, first, before I proceed to the questions you prepared, what made you agree to having to guesting in Dangpanan? I'm just curious, really.
I thought it's um, a pleasure to be one of your guests, to be the guest of the one and only Doc Shi TV. So I saw it as a big opportunity. So and I think it would be nice to also do this with you, raise awareness and
Yeah.
education. So thank you for for the service that you do to our community.
Ah, thank you. Okay. So, ayan na. Again, we grew up together. Dr. Josh and I grew up together. It's just that when he was, ano ba, how old were you? Grade 6? Grade first year? No, high
12,
school.
yeah, 12,
Yeah.
yeah,
So around
13, something
12,
like that.
yeah, they migrated to the US and so that was when I have no more playmate because he's my playmate. So, okay. So, ayan. How would you, sige, ganito na lang. Um, because what I learned when I was, reading about the sexual and gender minority, it is best to not assume. So that's what I learned, number one, to not assume. So let me ask, what pronoun would you like me to address you?
Thank you for asking that question. I think that's a beautiful question. I go by he, him, his.
Okay.
There are other
So
pronouns out there, but that's what I go by.
all right. Why I'm curious because when I started my classes there, I was uncomfortable writing my pronouns because we are not here in the Philippines. We are not used to doing that. So it's quite new to me. And then later on, I became comfortable, and then I realized it's very important that we are able to really identify what is comfortable for us to use. Okay. So thank you. So all right, at least I know and that is clear. Ayan. So, tell us first, what do you do? So, I introduced you earlier. You're an internist. What's your daily life? How does your daily day to day look like?
So I work in Phoenix and I have my kids here in California. I'm actually in California right now. It's my weekend off, so I'm able to spend Father's Day with them. How internal medicine works here in the US, especially if you work in the hospital, we usually have a 7 on, 7 off type of schedule. So, meaning
Mm-hmm.
we work 7 days, 7 straight days in a row, and then we're off for 7 days. And I was able to, so my kids are in California. I'm able to go back and forth because of that schedule. So I go
Mm.
to Phoenix, work there. I come back to California. There's just a different state, and I can be a full time dad here. I don't work when I'm here, so I feel like I can truly be present and be a father for them. So that's kind of how my schedule looks like. I did switch to night shifts, so
Mm-hmm.
I can have the same schedule as the Philippines right now. As far as my circadian rhythm is concerned. So yeah, and it's been quite nice working nights. It's less chaotic.
Yan. Okay. So that means for those days that you are working, you'll be in Phoenix, and then when you are not working, so you'll be more focused with your kids. You'll be in California. Correct.
That's
Ayan.
right.
Okay. So I'll just flash the topic once again, over the rainbow, care for the sexual and gender minority. So for those who are not familiar with SGM, it's the sexual and gender minority group. So this includes the LGBTQI. L means lesbian, gay, LGB, bisexual, T, transgender, T, Q, queer. I intersex plus, so much more. So um I just would like to start this conversation with definition of terms. So because we don't want to get confused what gender is, what is sexual orientation. So we will be more aware how to, when to identify somebody as male, female, and then we say that person is gay, lesbian, or whatever. So how do we differentiate gender and sexual minority, Dr. Josh?
Yeah, so the difference between gender and sexual orientation is basically so gender is what we're assigned at birth, whether we are boy, girl. There's certain areas where it's mixed. It can be a boy and a girl. It's
Mm-hmm.
very rare for that to happen, and sometimes there's no gender at all. They're not boy or a girl. So, and that's also rare. And so the two common genders that we know are boy and a girl, right? So that's gender, whatever you're assigned at birth. I think so. Sexual orientation is how we kind of perceive ourselves, and that kind of who we like. Therefore,
Mm-hmm.
and I think the common misconception is that sexual orientation is a choice. I think for all of us, it's really not a choice, who you like. And if you're a boy who likes a girl, or likes another boy, or doesn't like anyone, I think that sexual orientation is not a choice in that regard. And I think that's the difference. Gender is what you're assigned at birth, and sexual
Mm.
orientation is kind of what you formulate later on in life.
All right. So what I understand with what you said is that gender is because I'm an OB, no? I assigned the I assigned the gender at birth.
Yeah.
So it's either I say it's a baby boy, it's a baby girl, or it's a male or female. While the sexual orientation, as you said, is something na saan kami attracted to. I may be a female, but I can be attracted to a female. So I'd say that's lesbian, correct? Tell me if I'm wrong, as I said, I'm learning, I'm still learning. Or if again I'm a female, I'm attracted to, my attraction is towards the female and the male gender, then I am a bisexual. So same with the male. If a male is attracted to another male, that male is a gay, correct?
So far, so good.
Okay. So okay, that's good. At least I try to really memorize these things, so I would, it would come spontaneously, hopefully. But how about when we say transgender? When do we say that a person is a transgender?
So transgender, they change their gender. So I think a popular example would be, oh my gosh, who's the? She was in with the Kardashians. I say she because she's now a she. She
Yes,
was the
yes.
dad, something Jenner, the dad, right? So he was. He was a man, and then he decided that who he truly is a woman. So he changed his
Mm,
gender to a woman. He got that um, gender surgery. So she got boobs, and she even cut her penis off.
mm, mm.
So that's so transgender actually make they change their gender, not
Okay.
just mentally but also physically.
All right. So that means, so the popular paano ba, singer, celebrity here in the Philippines, if you know Charis Pempenko,
Oh
right?
yes, yeah.
Yeah. So she's assigned female at birth,
Hmm.
okay? And then she converted into
a male by making her by hormone treatment first, making her voice
Yes.
baritone, losing the boobs, so makes her a trans man, right? Because she's a woman
Correct.
and changed her looks into a man. So basically, it's if you know the ano ba yan? If you know the expression of those gay na sabi nila, isa akong babae trapped in a man's body. So they wanted to change how they look. So nagiging isa akong lalaki, isa akong babae na trap. So pag babae na na-trap, so when she changes kasi gusto niya maging girl, so she becomes a trans woman because from a male gender naging trans woman na siya. Okay? So I hope that is clear to all. So now, I hope it's all right if I ask you, ayan, nakunin na muna natin yung mga slides na yan. Since you said your pronoun is he, him, his, your gender is male.
Male. Male.
That's what you're assigned at birth.
Yeah.
Are you open that we talk about your sexual orientation before I ask you what your sexual orientation is?
Absolutely.
All right. So, since it's all right with you, can you tell us your sexual orientation?
Yeah. So I'm a male, but I'm gay. So that's my sexual orientation.
Okay. So that means Dr. Josh has a boyfriend and I've met. Oh, I'm sorry. Is it tama ba? Is it okay? Is it right that I call a boyfriend? No, partner, no? It's more inclusive. Tama ba? Is that I'm
No,
not sure
I think you're
again.
good. No, you're yeah,
Okay.
it's
All
fine.
right, because again, I'm trying to identify the terms. Why? Because for me, it might just be something like no, it might just something ano ba yan? Not very important for me, but for others listening, it might be a sensitive topic for them. So again, I want to be careful on what to use. So, oh my gosh, so proud of you guys by showing the world your unique stories and perspectives. You're making a tremendous impact on all of us.
Wow.
Wow.
What a
Thank
nice
you, Kuya.
message.
Thank you, Kuya Boyat, for doing this. Yeah, hi. Okay, ayan. All right, yeah. So, I'm glad that you are open to telling us your sexual orientation. Being a physician, does your sexual orientation affect your work?
Um, Very rarely.
Mm-hmm.
I don't. Um, you know, how do I? It's definitely a difficult subject to discuss when when it's a big deal. When, for
Mm-hmm.
example, if there's a family member who's openly anti-gay, I
Mm-hmm.
think it becomes difficult. But I think living in the U.S., it's more progressive and kind of liberal way of thinking, so it hasn't really been that difficult. But then I also don't openly like make being gay my only identity. I
Right.
think for a lot of people, they assume that being gay is kind of your only identity, but it's really just a part of who you are. Um, it's it's a big deal to be who you are, but it's not
Mm-hmm.
everything that you are, right? I'm also a father, I'm a doctor, and I'm all these titles. So I think
Mm-hmm.
for me, when I'm at work and taking care of patients, I wear that hat, I wear that physician hat.
Mm-hmm.
And um, at that particular time, that's what's important to me more than my sexual identity.
Right. I love it when you said there is more to just identifying sexual orientation or your gender, because truly we wear a lot of hats and it depends on the need. Whichever need arises, we just try to deliver. And I'm happy to hear that it's not affecting you in any way, because we know that in statistics it's not like that all the time. Not all sexual gender minority have been blessed with an environment that is inclusive. Because when we say inclusive, we really give them the same opportunities, the same treatment as their cisgender counterparts. So, um, what does the statistics say about the sexual and gender minority in their workplace first?
As far as being safe in the workplace,
Mm-hmm.
or how many people are gay in the workplace,
Mm-hmm.
what's is
Yeah.
there a
Well,
specific?
is there did you were you able to read any statistics that tell us that there in the US it's still very difficult for them to shout for inclusivity in the workplace, or it has improved over time, or it's not a problem? Like what you said, oh, it's not a problem for me anymore, like unlike the others.
Yeah, I didn't find any statistics per se about what
Mm-hmm.
percentage of people in the workplace consider gay. I think I don't know if such study or studies even exist,
Even
but there's a Gallup poll that I pulled up. When was that? I
mm-hmm.
think it was in 2012.
Mm-hmm.
Um, or maybe in 2010, that state
Mm-hmm.
that 7% of the population consider themselves gay. And, obviously it kind of changes, right? But based from what I hear, it's around that percentage. It's about 10% ish that consider themselves, in the LGBTQI population. So I think, um, the rule of thumb that we like to kind of go by is, one out of every 10 people are gay. So,
Mm.
you know, in a wedding venue with like 500 people, right? I mean,
There are
or 50. Or is
50.
that right? Or five?
Yeah.
I don't know.
10%.
Five. Yeah, 10%. Yeah. So, no, it'd be 50. 10% of 500 would be 50.
50. Okay, ayan
Yeah.
na.
So yeah.
Yeah.
So it's quite
'Di
a
ba?
lot,
I
you
am
know?
Miss Know It All except math.
Yeah. So it's
All
about
right.
10%
So,
usually.
because I'm not saying naman no that here in the Philippines they really struggle, because um for me it's not an issue for me. Actually, I have friends, I know people who are gay, that wala namang problema in the workplace. However, in the research that I did, because I'm doing this in class, and in fact one of my classmates in class wanted to study on the effect of the being a gender and sexual minority towards their progress in the career in medicine. Unfortunately, the advice of our professors was he might not have enough subjects for that, because
Mm.
it may be they are not yet open to talk about it, number one. Number two, if they are open to talk about it, will they be willing to be part of the study and be part of the record? So what happened, hindi it did not proceed as how he proposed. So that's a difficulty there. What I see is that they struggle with inclusivity, meaning with job promotions, of course, the bosses, according to what I read, that prefer the bosses prefer cisgender people to fill in their shoes once they would want to retire already. So those are parts of the statistics. And they have it was one time I've read that they had to really put extra effort just so they can show that they deserve where they are. They have to really prove themselves um, in the workplace. How about health? Because we are doctors and we've seen a lot of patients. What have you observed with the delivery and the acceptance of healthcare among the sexual and gender minority in your setting?
Yeah. Um, I just wanted to define something that you mentioned as
Okay. Oh
cisgender.
yeah. Yes.
So a lot of people may not know what cisgender means. So
Oh, yes, yes,
cisgender
yes, yes, yes.
means that your gender at birth is a male, and you also identify as a male. And yeah, same thing for female. You were born a female and you identify as a female. So when somebody says cis male or cis female, that means that you're pretty much straight, right? So that may be something that not a lot of people know, and that's even
Correct,
something that I
correct.
didn't know. Being a gay male, and I was like, "What is
Yes, yes.
cis?" Like I thought cis was like, "Oh, hey cis," like kind of like that, right? But cis is CIS, so cis male, and then cis. There you go. Thank you for typing it out. Um, I think maybe in the Philippines it's probably more like that, but here in the U.S. It's considered discrimination, right? If you promote somebody because they are um, they're straight, or you don't promote somebody because they are gay. I'm sure something like that happens, and if it's very known and if they're very vocal, then you can go, the person who's not being promoted can actually sue the employer. And so that's something that all employers go by, that they can't discriminate based on gender, sexual orientation, religion, color, and things like that. And so if there's an employer or a boss that openly says, I'm not going to promote you because you're gay or you're whatever, then if that's caught on camera, or if there are a lot of people that can testify against you for saying something like that, then you can definitely lose your job. So we're also protected by the government, which we're so lucky having that protection by the U.S. government, and I think that's kind of the difference in the Philippines, because there's no protection from the government in that sense. So it's definitely difficult, but
I
here
agree.
we're lucky enough.
Yes. So I agree that we don't have that here. We cannot even have a, sorry no, the justice, napunta na sa justice system yung usapan. Attorney Simon Peter Halad, pasok. Okay. Yeah. So yeah, I agree that unfortunately it's difficult for us to find proof that it was the reason for not getting you promoted. And so yun nga, it's just unfortunate to hear those stories, no. How about being a doctor? What's the difference there? So para I can also share my own experience with my very very cute experience muna for a few years. So tell me your experience with in healthcare among the gender and sexual minority.
Yeah, so I think for me, when it comes to kind of having people like you, right, or having my patients like you and building rapport, I don't kind of I let my actions speak for themselves. So when I want to be kind of maybe accepted by my patients, I don't introduce myself as like, hi, I'm Doc Josh, I'm gay, blah blah blah. What I do as a physician is that when I really focus on them, on my patients, and doing what's right for them, and making sure that they're taken care of, I think my actions transcend my sexual orientation, or the other part of who I am, right? And so when ultimately when I do the right thing as a physician, people don't care what your sexual orientation is,
That's right.
or sometimes they may be surprised that you're gay, or sometimes they're not surprised that you're gay. And for me, it's kind of it kind of goes back to what I was saying, that like me being gay is not everything that I am. At work, I truly kind of make my patients I let them know that it's I'm there for them, and I'm not doing this to be to be accepted as gay. My them accepting is on them. So if they don't, if I still take care of them the best that I can, and they don't accept me, that's kind of up on them, right? And I can't
Mm,
change them for that, and that's something that they will eventually have to face in their lives.
mm,
It's not my job to change their perception. It's not my job to, argue about, is being gay a sin.
mm,
That's not what I'm there for.
mm,
Morally speaking, it's my
mm,
obligation to take care of my patients,
mm,
whether they accept me or not.
mm.
And I think that's kind of the struggle sometimes, because how can you take care of somebody who discriminate against you, or who, doesn't like you for who you are? And that's why we take an oath, right? When we become a doctor, to first do no harm. And that's kind of my guiding principle as a physician.
Yeah. So what I like with what you said, ito yon, I'll just flash for emphasis. It's our moral obligation to take care of patients. So because what one difference between me and you, although we have so much in a common ground, we have so many things in common, is our gender orientation, no, sexual orientation. I am, as you said earlier, kasi I forgot to emphasize the term that I've been using, no, for the, yeah. I'm straight. I have a husband and 3 kids. Happy Father's Day, Dada J. So yeah, but they always ask me why I'm so strong with this advocacy. Perhaps because number one, someone very important to me, and that's you, opened my eyes to this. It's a different perspective that what I am outside being a doctor, as a wife, as a mother, is different with my moral obligation as a physician. And I feel that it is important that I make them feel safe when they go to me. So I had this one experience. So not all patients are open to telling me their sexual orientation. Kaya lang, some of my questions require them to tell me. For example, um, they come with irregular menses, and then since I was not yet aware of this, I directly asked them, any chance of you being pregnant? So they say, no, doc, there's no chance of me getting pregnant. What made you so sure? And then they would answer me, because my partner is a female. And then, since I was not yet that siguro aware that, I can get patients like that, I'm not so sure how I reacted then. And I don't want that to happen again, na ako yung parang uncomfortable. I wanted to be holistic, as I said, that this platform, what I do with my care is holistic. I want to be holistic and inclusive. But I cannot do that if I don't know how to take care of these patients. So since then I have been reading, and one time, I'm just happy to share this. They had a virtual consultation with me, and then I was asking, because there was a lesion in the mons, no, in the private part. For those listening, there's a lesion in the private part. It looks like an ulcer na parang kinamot, tas na pumutok, so nagpas, no, and then became an ulcer. So of course, in my mind, I'm I'm thinking of STD, because there are STDs that will ulcerate, di ba? And then um the patient was asking me of mode of transmission. So, and then she said, doc, I have a female partner. So that history is very important for me to be able to rule out some other causes of the ulcer. So I said, oh, thank you for letting me know. I failed to ask when I was telling all these. I'm happy you told me, so I can fit my diagnosis and my treatment with the history that you gave me. And truly, so they came face to face at the clinic. And then I was just so happy, because the partner said, doc, ako ba yung partner? Ako yung partner. I'm the partner. So of course I know. Thank you for being there, accompanying the patient. And then parang I really saw that but parang nag-brighten yung eyes niya, and they became comfortable taking care of each other. So for me, that is well, I say it's a very important milestone in being a doctor, because I felt I was able to make them feel comfortable, and they are able to maximize their purpose of coming to me. And if not for this, I would not be able to do that. So I'd say, truly, it's my moral obligation to learn on how to handle patients like them. So because of that, I would just like to ask, is there an actual health disparity issues with the patient? For example, I'll set an example. Some patients are embarrassed to come, especially when they are trans, meaning she's a female but looks like a male. So lesbian, sexual orientation lesbian, but looks like a male. Pero alam mo kasi, you will know that she still have the female sexual characteristics, kasi hindi nawawala agad yung she still has the vagina kahit wala ng boobs. So some of them are awkward coming to me, seeking consultation. Is it the same there to the present?
Yeah, that was such a powerful story, and I just wanted to comment on that. Like I think
Yeah.
that story kind of, if we just kind of take a step back, right?
Mm-hmm.
That's a lot of our stories, and I think the underlying thing there is being seen.
Mm-hmm.
There's so much power with just being seen, like because if you did not make the partner feel seen, kind of, I
Mm-hmm.
mean, they probably wouldn't want to go back to you, number one. And number two, you wouldn't have taken care of them appropriately as a physician. So I think just acknowledging that they exist, acknowledging that, their behavior is, it's not my kind of behavior, it's your reality, but that's, I'm still going to take care of you. And I think just being seen and being felt like, you're taking care of them regardless of your difference is truly powerful. And we definitely need more physician,
Mm-hmm.
doing what you're doing, to change lives for the better. So thank you for sharing that. So yeah, there are a lot of disparities, and I'm so sorry that I wasn't able to make a PDF or a PowerPoint slide of this. But just as an example, women having sex with women compared to straight women or cis female,
Mm-hmm.
um, they were less likely to have had a pap smear or a
Mm-hmm.
mammogram. And the
Oh.
statistic was 66% versus 80% had a pap smear. And then for a mammogram, it's 53% versus
Oh, it's
73%.
low. Mm.
Yeah, so it's much lower. And just having preventative care, pap smears, right, are for prevention, even if you're not really having symptoms. Mammogram is for prevention, even if you're not having symptoms. I mean, just for a woman who is having sex with another woman, just having preventative care where they don't have to disclose who they're having sex with is difficult enough. How much more the statistic of those women, when you're talking about, possibly having a sexually transmitted disease, is much lower. And that's because they have to open up their vulnerability, and
Mm.
sometimes they have to, like, quote unquote, show weakness, right?
Mm.
By showing who they're having sex with. So it's definitely much lower, and the stats are there. Studies have been done on that, and same thing with gay men. Um, Getting checked for HIV is much lower, even though gay men have the most prevalence of HIV. And it's for those reasons. We feel like, number one, we're not seen anyways, so why do we want to be seen, um, in the first place, especially by our physician who possibly will treat us differently. So there's definitely, it's not just medically, but, like, I think psychosocially, there's a lot of
Mm.
barriers
Mm.
by minorities and, the LGBTQ population.
I agree. It's good that you mentioned about pap smear and mammogram because last month, May, here in the Philippines, we celebrate Cervical Cancer Awareness Month, and
Mhm.
we've emphasized the purpose of pap smear. However, kaya lang, our lesbian sisters may have, or yeah, less the sexual and gender minority might think they are excused to getting the HPV. That means
Mhm.
if they are having a female partner, they would think perhaps I will not get the HPV that will cause cervical cancer. But I'll just take this opportunity that no, any one of us can get the HPV, even the male can get the
Mhm.
HPV. And so, regardless of who our partners are, we should be screened for cervical cancer, and that's through pap smear and HPV testing. While for the mammogram, as long as you have breasts, so even the male has breasts. So we'll really have to screen ourselves, not through a mammogram. Our gender, because of the hormone, the biological makeup, puts us at risk for breast cancer, and so we have to do mammogram. So again, I'm pointing this out. So whoever, if you are listening and you know somebody who needs to do this, she's already this old and never had a pap smear because she thinks, oh, I have a female partner naman. You tell them, I heard in Dangpanan that you still need to do a pap smear. So, ayon. So, yeah, since you mentioned about the barriers, I would just like to show this. Ayan. To show this photo. This is a common photo that when you Google about the difference between equality and equity, this is what you see. So, just so for discussion purposes, no, Dr. Josh, what do you think is a better picture that shows what equality versus equity really looks like?
Yeah, the picture on the right.
Okay. So, may circle na din, no? Sorry, hindi ko naalis yung circle. So, nag-give away pa ako. So, yes, I agree with you. So, as you said, there are a lot of barriers. It's not only the healthcare providers, it's not only the health institution, it's also the psychosocial environment, it's the financial capacity that
Mhm.
are barriers to healthcare. So, as you can see, the picture dito, okay, you will see that the grass has different levels. And in equity, we see that since the grass is of different levels, there are boxes ba ang tawag dyan? Boxes depending on how high the kid needs for the child to see the baseball game. So that means in healthcare, if we translate it, in healthcare, it will look like this. Giving a mountain bike to all patients is equality because you want to be fair, equal lahat. But can somebody who is disabled use the mountain bike? Can a 5-year-old use the mountain bike? The answer is no. But if we give equity to all, that means we give a bike to all. That is what that person needs. So equity means giving a bike that is fitting to somebody that is disabled, giving a child's bike to a 5-year-old. So that is equity, meaning we take into account the differences of the person. So, why do we take time discussing the sexual and gender minority? Because they are still part of the community that has different needs in comparison to their straight counterparts, but it does not mean we give them the same, but we give them the same care depending on their need. So I don't know if it was it was clear, but you might want to add something, Dr. Josh, with what I said.
No, I think you were on point with your discussion of that one. I mean, we don't give kind of the same resource, to everyone, right? And it really depends on their need. So I think as a physician, it's very important to identify what those barriers are. And I think that takes a very aware physician for somebody to give, different resources depending on the certain need of the patient, right? So, you know, once you've identified that your patient is from the LGBTQ population, kind of changing the way you think. What are their barriers for them to be healthy, right? Is it do they need to be more open? Are they not seen? Do they have parents who don't accept them? Do they have um, uh, dip- uh, kind of identifying those different barriers that will lead to them having a more healthy lifestyle, and the same is true for, our cis brothers and sisters. What are your barriers? Is it, are you not, are you just in denial of your health? Are you in denial of your diagnosis? Are you not understanding your diagnosis, and kind of, identifying what's preventing you from taking care of this patient the best that you know how, and once you've identified those barriers, you can be a more successful physician to your patients. So that's pretty much what equity means. And you were on point with your definition.
Ayan, okay. Yes, I really see that this image is quite powerful paano ba yun? In discussing what equality versus equity is, because equality and equity is not the same. So I just want to make it clear na hindi po magkaparehos ang equality and equity. So ayan. So Dr. Josh, is there is the purpose again of Dangpanan is awareness. So, we were able to make them aware of the preventive measures that whether cis or sexual gender minority people have to follow, have to observe. How would you, siguro, your advice to our audience who are perhaps battling with seeking help uh, as a patient siguro to us doctors, because in my program naman I don't have much physicians watching unless it's you, me, mama and papa watching. So we are the only physicians
Yeah.
usually watching, and although we have medical like nurses watching us, but ilan lang kasi ang very few physicians watch this because it's meant for lay people. So if you were to give an advice to the lay people to bridge the health disparity, the fear of seeking help, not only seeking help, but also accepting help and ano ba ba? Seeking, accepting, and staying healthy. What will be your advice to the lay watching us tonight?
I think, my advice would be, I'm just trying to kind of think, if I was in a doctor, what would I do, right? If I was
Yes, yes.
seeking, help. Um, I think first and foremost, it would be very hard for you to seek help if you're not honest with who you are. I think, um, being uh, uh, being true to yourself. You know what I mean? Because if you are still kind of in the closet and finding yourself having so much shame about your true sexuality,
Mm-hmm.
it becomes very hard for you to open up. I mean, how can you expect other people to help you if you're not even honest about who you are, right? So I think that's kind of before, we talk about, seeking help and having other people help us. Ask yourself, who am I, and do I really know who I am? And once you know who you are, accepting it for yourself too. And I know that's such a big umbrella word, like as if it was so easy to do. Like just accept, just accept. I mean, I think that's kind of the hardest thing to do. But once you've accepted your reality, um, it becomes very easy for everything else to do. Meaning, because
One step.
yeah,
It's
yeah,
one step.
that's the first step, and you're not going to let other physicians kind of you know treat you like you're not worth anything.
Mm.
And if there are physicians out there who treat you differently because of who you are, you you have the choice to go somewhere else, right? And so, and because you've accepted who you are, you're not going to let other people treat you as if you're much lower because of your sexual orientation. And so I think that's really the key, right? Because if you haven't accepted who you are, and if somebody treats you differently, then you're just going to be like, you know what? Maybe I shouldn't be gay because of whatever reason, because
Mm.
so and so treated me differently, because, Doc Shi treated me differently because I'm gay. And so if Doc Shi doesn't treat you how you want to be
Then go
treated,
to Doc Josh.
gay, then go to Doc Josh. So that's the beauty of accepting yourself. You're not gonna feel sorry for living your life, and you're gonna find somebody who will take care of you if you have accepted yourself. So I think first and foremost is acceptance, um, and uh, um, and then I think once you've accepted yourself, knowing your risk, and being honest about that, because HIV is no joke. HPV is no joke. That leads to
Mhm.
cancer. STDs like syphilis can lead to heart condition, untreated gonorrhea and chlamydia. And so for women who want to be pregnant and they have
Mm.
untreated gonorrhea or chlamydia, it can lead to, pelvic inflammatory diseases and a lot of problems, right? That can make them not become pregnant later on. So knowing your risk and getting tested for sure, and finding a doctor who accepts you for who you are. And I think those two basic things are, they may seem so easy, but they're really hard to do as a patient. Acceptance and finding a doctor who will accept you.
I agree. So, well, you're talking as a patient now. You said if I am not a doctor, how would I advise? So, I agree with you saying that being honest is very important, because if I talk as a physician, it's important for me that you'll be honest with me, because I cannot
Mhm.
treat you accordingly if you're hiding something.
Right.
I would. I know there's something missing, but I just can't point it out if you are not honest with me. And yes, number two, acceptance. Because if you do not accept that you are this and that, well, who else will? I mean,
Yeah.
if we can't wait for the world to accept us. We have to
Yes.
start it within ourselves, and then again, once you are able to accept that, you will be able to see the other parts of yourself beyond just that. And the world will be able to see and everything about you, not only that. And know your risks, because I cannot force you to watch Dangpanan and visit me at the clinic or visit Dr. Josh. It is you who comes to us for help. And if you do not know your risks, we can't help. We can't help you at all. So yeah, those are very wonderful, concise advice that I hope our viewers are able to get tonight. Um, how are we? It's almost an hour.
Wow.
So we're just like as if we're talking. It's been how long? We've been busy. I know the schedule of Dr. Josh. He was so busy, and we were just able to chat a few conversation earlier today here in the Philippines, last night with him. So any parting words before we say goodbye with our hour long episode tonight?
Yeah, I think just in summary, I just want to say
Mm-hmm.
that, being in the LGBTQI family, people may see it as a weakness. Like I know, maybe maybe it's changed now. But back then, I think for me, one of the barriers that made me not want to come out sooner is because gay people were always seen as weak, the weaker kind of gender, if you will, right? Like, I was so afraid to come out because I was labeled all these things, like I was weak, I was a sinner, I was all of the things that I was so insecure about, like
Mm-hmm.
how can I be true to myself if I mean, who wants to be weak, right? Who wants to be a sinner, and that was so hard to be labeled that, or to like just even hear those kind of things. And I think when I once I truly accepted myself that, what, I'm being loved regardless of who I am, and like I'm not a criminal, I'm not a thief, I don't, I was able to really change my way of thinking. And I may be gay, but guess what, I'm also a father, I'm a physician, and I take those two things very seriously. Fatherhood is not an easy job, and it's something that I'm still able to do, despite me being gay. I can be an investor, a philanthropist, and all of these things. You know what I mean? And I can't let me being gay just define who I am, because it is just a small portion of who I am. And, if you see gay and lesbian people, they are politicians, they are lawyers, they are doctors, they are changing the world. Just like other people, just like our
Just like
straight
women.
counterpart. Yeah,
Mm,
yeah.
minority.
And that was really powerful to have. And so I just wish, other people can also live their realities and be true to themselves, because there's so much power in living your true, authentic self.
Wow, that was a powerful takeaway summary for this. We have been receiving a lot of comments, especially from our cousins. Thank you very much for the
Thank
support, for
you.
being
It
with
means a
us
lot.
tonight. There's this is quite long, so let me just read one comment from one of our viewers. It says, "Kudos to both of you, mga dokis. Having a progressive mind, regardless of gender, each one is deserved to be treated fairly in all aspects, including medical help. All of us are born naked when we came out from our mother's womb. Therefore, all kinds of gender must be taken care of equally in any medical setting. And for the doctors, irregardless, whatever his her gender, must not be discriminated for as long as she is rendering the profession with moral obligation to care, to cure, and to save lives. If given a chance to visit, ah, Ati May has a sister also there in Arizona. That's right. If
Oh,
given a chance to visit my medtech sister working in Arizona, I will probably get your service, Doc Josh, if the needs arise. Good luck to
um,
both of you. Aww. And hi, Auntie Susan. Thank you for being with us tonight. It's like an online reunion for the Halads. Yeah, so I guess everything that's good has to come to an end. It's what time is it there? It's
it's 6:09 a.m.
6:09. Yes, it's 6:09 a.m. there, and I'm pretty sure you still have to prepare because the boys are there. And I just would like to say hi to Kuya Genesis. I hope you can watch this later when you wake up, and to Auntie Ason, Uncle Kopi, Kuya Brian, and Kuya Ted, the brothers of Dr. Josh. So, once again, thank you very much, Dr. Josh, for being with us tonight. If you can stay at the backstage while I say goodbye to the audience, I hope that's all right.
That's all right. And happy anniversary to you and Jay.
Oh, thank you, thank you. Yeah, we are. We're here at the hotel. Actually, we're not home. So medyo, kaya ang ganda ng
Oh, I thought it was your
lighting.
mansion.
I'll wait till you are able to renovate our home.
Oh, would love to do that.
Yeah. So yes, we are celebrating our anniversary tomorrow. So again, thank you, Dr. Josh. If you'd stay, give me a few minutes with the audience first. Okay, thank you. So I just would like to announce that tomorrow is a no clinic day for me because it's a special day for me and my husband because we're celebrating our anniversary, our 13th anniversary tomorrow. So I hope that's all right. But if there's anything urgent, you can message the page. You can message. Try and see if I can put in some virtual consults in between. But I hope if we can postpone till the Tuesday, the next day. So I would really love that. Okay. So once again, it was a wonderful topic, timely, and I hope you have learned, especially on the care for the sexual and gender minority. Once again, it's not just medicine, it's lifestyle. This is Dr. Shi, and you are watching Dangpanan. I hope you'll be with us in the next episodes of Dangpanan. Thank you very much, and happy Father's Day to all dads who are watching with us tonight. Bye.